Hello everyone, today we are going to begin one of the most important topics in pharmacology, the adrenergic system, which represents the sympathetic division of the autonomic nervous system. If you remember one concept, remember this. The adrenergic system prepares the body for fight or flight situations. Now let's start with the basics. The main neurotransmitters involved in this system are norepinephrine and epinephrine. These are synthesized from an amino acid called tyrosine. The synthesis pathway is very important. Tyrosine is converted to TOPA, then to dopamine, then to norepinephrine, and finally to epinephrine. This process occurs in sympathetic nerve endings and also in the adrenal medulla. Now let us understand storage and release. Norepinephrine is stored inside synaptic vesicles. When a nerve impulse arrives, calcium enters the cell and triggers the release of norepinephrine into the synaptic cleft. Now comes the most important part, the adrenergic receptors. Adrenergic receptors are divided into two main types, alpha receptors and beta receptors. Let us start with alpha receptors. Alpha receptors are of two types, alpha 1 and alpha 2. Alpha 1 receptors are mainly present on blood vessels. When they are stimulated, they cause vasoconstriction, which increases blood pressure. Alpha 2 receptors are located presynaptically. They act as a negative feedback system by inhibiting further release of norepinephrine. Now let's move to beta receptors. Beta receptors are of three types, beta 1, beta 2, and beta 3. Beta 1 receptors are mainly present in the heart. When stimulated, they increase heart rate, contractility, and conduction. Beta 2 receptors are found in smooth muscles such as the bronchi and uterus. They cause relaxation, leading to bronchodilation. Beta 3 receptors are present in adipose tissue and are responsible for lipolysis. Now let's understand how the action of norepinephrine is terminated. The most important mechanism is reuptake back into the nerve terminal. In addition, norepinephrine is metabolized by two enzymes, monoamine oxidase, also known as MAO, and catechol O-methyltransferase, also known as the COMT. Now let's summarize the overall effects of adrenergic stimulation. The body enters a fight or flight mode. There is an increase in heart rate and blood pressure. The bronchi dilate to allow more oxygen. The pupils dilate, gastrointestinal activity decreases, and blood flow is redirected to skeletal muscles. Now let's quickly revise the key points. Alpha 1 receptors cause vasoconstriction. Alpha 2 receptors decrease norepinephrine release. Beta 1 receptors stimulate the heart. Beta 2 receptors cause bronchodilation. And beta 3 receptors promote lipolysis. Let me conclude. The adrenergic system is essential for survival during stress and emergency situations. Understanding these receptors forms the foundation for learning adrenergic drugs in pharmacology. If you understand this clearly, the next topics will become very easy. Thank you.